Now, the World Health Organization says, among other things, health makes an important contribution to economic progress as healthy populations live longer and are more productive. In our Ask the Expert segment today, we spoke with Jennifer Blanke, Vice President of Agriculture, Human and Social Development with the African Development Bank Group, and asked her what strategies can African countries adopt to improve the quality of health and positively impact their economies.
Health is obviously the sine qua non, together with education, I suppose, of development. If you don't have a healthy population, it's hard to talk about just about anything else. Now, we recognize how important it is, and mainly the way that we're tackling this, obviously we look at some specific issues, but it's by working with governments and making sure that they're prioritizing the right things in health, making sure that they're not cutting back on health when, of course, there's lots of priorities in government, and helping them to think through value for money. Because we know that, governments everywhere and governments in Africa are strapped for the kind of financing they need to do just about everything. So how do you make sure that, learning from the best experiences in other places and in Africa, that African governments are really spending in a smart way so that they can provide at least basic health care for their citizens. Another thing I would say just related to agriculture is nutrition. Which is massive. As we know, there's a huge amount of stunting and wasting in Africa because young people don't get enough, not just calories, they don't get enough nutrition. And so a big effort in this area, harnessing, for example, through African Leaders for Nutrition, where we're bringing together the leaders of Africa to point out how important this is. Why? Because we're talking about developing gray matter infrastructure. This is all about, if you have stunted people today, you'll have stunted economies today, and you'll also have stunted economies tomorrow. And so it's really a bottom line economic issue. And so we're really focusing on the first 1,000 days of life from conception, which is when really that gray matter infrastructure is developing, and it's really picking up steam. If you think about value for money, it's the sort of thing, where are you going to focus, right? If you have to start, where are you going to focus? And an example would be looking at neonatal care, for example, making sure that you're getting the right kinds of medicines and preventative medicines to the citizens. And, for example, we'd say you don't have to build a fancy new hospital in a rural area, for example. We have methods of making sure that you roll out sort of basic infrastructure using the latest technologies and training up people with a lot of the basic things that you need to do. Just provide that health care that makes sure that people are getting, a basic level. And this already will boost the quality of health of people around Africa.
And that was Jennifer Blanke sharing some strategies to improve the quality of health in African countries. If you have a medical question that you would like to have answered, tweet me at Linor Moudou, and we'll have a medical expert respond to your query.